It is the latest virus spreading across the United States, and the exploding case count has doctors expressing serious concerns. So what is monkeypox? How does it spread? What are the signs and symptoms? And how can you stay protected? ABC's Andrew Dimber reports.
Overall, really miserable, swollen lymph nodes, not good.
I've got these on my arms and hands that you can see. They are really not cute.
For Matt Ford, it was first the spots that raised the alarm, then came the symptoms, many of them similar to the flu.
Fever, sore throat, cough, full body chills, sweating through my sheets at night, and I went and got tested.
The diagnosis? Monkeypox, a virus rarely detected outside of Africa, and it's now making its way through the United States.
This experience was one of the most painful things I've ever gone through in my life. More lesions appeared as the flu-like symptoms kind of went away. I think in total I counted more than 25 all over my body. Some were really excruciating on more sensitive skin. Others at best were really itchy and annoying. I had to go back to my doctor again to get pain medicine just to be able to go to sleep some nights.
Matt's illness lasted for 3 weeks.
So the reason I'm speaking out about it is because I tweeted about it and it kind of started to blow up.
So he decided to make his story public in hopes of raising awareness about a virus that's spreading at a substantial speed.
I guess I wanted people to take it seriously because I was one of those people who didn't take it that seriously before it directly affected me. I knew monkeypox was this thing out there in the ether that potentially was something to be worried about at some point. And then it became very real very quickly in my life.
More than 2,300 cases have been reported in the country, and it's been just 63 days after the first known case. And New York, like with COVID, has become the epicenter of the virus in the U.S.
And that's probably an undercount. So it's something we need to take seriously, not to panic by it, because we do have a lot of understanding of it. So we're not in the dark about this, although we really must take it seriously because it is, in fact, spreading at a rate that we feel we must address.
This is not a new virus. The first human case of monkeypox was recorded in 1970, a rare disease with an unknown origin. According to the World Health Organization, the current monkeypox spread probably began at big parties in Spain and Belgium. In the U.S., nobody has died of monkeypox, but the symptoms can be painful and typically start within 3 weeks of exposure. The telltale signs: fever, headache, muscle aches, swollen lymph nodes, chills, exhaustion, and a very painful rash unique to monkeypox.
It is an infection that is spread by close physical contact, skin-to-skin contact.
Apart from spreading through skin-to-skin contact or touching the rash, monkeypox can be passed through prolonged face-to-face contact, such as kissing, or by touching items that were used or came in contact with the infectious rash. There is treatment and a vaccine available, but these days getting an appointment is not an easy task.
In New York City, a batch of 8,200 appointments released on Friday night were booked up in just minutes amid a nationwide vaccine shortage.
There are not enough vaccines to keep up with the demand, says the CDC. In New York City, long lines and people trying their luck.
I came here for like 3 days already because I don't have an appointment. I went to the website and the website crashed. I'm concerned about the monkeypox virus because I'm working in the field, like nightlife. You know, when we're working, people kissing you, people hugging you, you know.
The Department of Human and Health Services announcing more than 300,000 vaccines have been made available since May, and a shipping of another 700,000 is in the works, plus 2.5 million doses should become available in 2023. But for now, vaccination is limited to the populations most at risk, including anyone who has been exposed and men that are sexually active with other men.
If you look at the numbers, the overwhelming proportion of people who have been infected are men who have sex with men. But it is not exclusive to that demographic. But there's no place at all for any stigmatization when you're dealing with a public health issue.
Yes, it is high within the queer community right now, but it is not targeting queerness.
In the LGBTQI community, monkeypox feeling like a throwback to the discrimination gay men faced when HIV first came around.
I got some really cruel DMs and comments, messages from people. There were a few comments that referenced that maybe this was like God's punishment in some way to like gay men, which kind of echoes some sentiment that we saw during the HIV epidemic.
The reality is that the virus does not discriminate, and cases have already been reported outside of the LGBTQI community. Cases are growing quickly, especially now that the testing capacity has been expanded to 70,000 tests per week, and an uptick is expected during the rest of July and August, and there's no clarity yet about when the vaccine will be widely available. For high-risk groups, prevention for now seems to be the key.
What I am telling people is just being really mindful of who you're in close proximity with, especially people in the demographics like the queer community who are most at risk. Get vaccinated as soon as possible if you can. Obviously there's a short supply, but more are on the way. So as soon as you can, even if it's just the first shot, get it ASAP.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.